Hi everyone, it's Dr. Jhawar with Revive MD Direct Primary Care. It's September and it's Prostate Cancer Awareness Month, so we're going to talk a little bit about prostate cancer screening guidelines. I have many patients who ask me when they should start to get screening tests done, and what age and what their risk factors may be. So generally, in average risk males, it's recommended to start doing prostate cancer screening tests at the age of 50. And the screening test that we use is the PSA test, which is prostate specific antigen. It's a blood test that's done usually once a year. And typically it's done when, a lot of my male patients come in for their annual physicals. That's usually when we order that. The digital rectal exam is no longer recommended as a screening tool for prostate cancer. The PSA is really the more specific test. Some men may need to get screened at an earlier age in their 40s because they have certain risk factors like family history of prostate cancer at a young age, African American males, those who have maybe some genetic mutations that put them at increased risk for prostate cancer. So those are the times that, you may want to have a discussion with your doctor to figure out, if you need to start getting screening tests done at an earlier age. But typically it's age of 50 and older, and it's usually once a year. The other thing I will mention is that the PSA test, when it's elevated and it's usually like above the level of 4, that's when, we get a little bit alerted to that, that it might be due to prostate cancer. Typically levels less than 4 are normal, but there are other things that can cause elevated PSA levels besides prostate cancer. So very commonly, men who have an enlarged prostate, which is benign, that can also cause elevated PSA levels. Those who also may have prostatitis, which is an infection of the prostate, they can also get elevated PSA levels, and that's usually temporary. And then the last thing that can also cause elevated PSA levels are certain medications like testosterone replacement therapy. That's also something that can elevate your PSA. So, these are just some examples of other things that can cause elevated PSA levels besides prostate cancer. And it's a good discussion to have with your doctor when you see him or her for your annual physical. So I'll be back with more videos, but I hope this gives you some information about prostate cancer screening tests.